during life was confused, couldn't remember, when the individual gets to post-mortem examination, you find a particular lesion in the brain which accounts probably for his dementia in life. So dementia is the clinical manifestation. Alzheimer is the pathophysiological reason why the person is demented, or the particular type of lesion, of brain lesion, that causes dementia. Alzheimer is not the only reason why somebody can be demented. It is the most frequent reason, but not the only one.
Let me understand something just about that. When somebody tells you that you are crazy, that you have dementia, it's because you do crazy things. You don't do it. You are like, or you hallucinate, or you. Many people think about that. And Alzheimer is when you lose your memory, or there is more when you have Alzheimer.
The manifestation of Alzheimer is not only losing your memory, but it's also losing your judgment, losing your understanding of your surrounding. Hallucinating, being delusional, being confused is not just losing your memory. So it's not somebody who is otherwise absolutely normal, but he doesn't remember. There are conditions, this is not Alzheimer's, there are medical conditions when somebody loses only the memory, but this is not Alzheimer. Alzheimer is losing memory, judgment, orientation, very slowly losing the ability to walk, losing the ability to swallow, losing control over sphincters, meaning pee-pee kaki. It's not just losing memory.
Tell me something. I know there is not a cure. We won't talk about a cure because we know there is not a cure. But there is something that can tell us that somebody can have some story or something that we can do to our kids, to us, to somebody, and say, you are in a big probability to have Alzheimer?
I didn't understand the question. Can you repeat?
Is there something to prevent, to think that, or to advise somebody that you can have? Because I think it's not is there something, a study, what we can do to somebody and say, you have a lot of probability to have Alzheimer?
Well, you are asking two questions. Let me break the question in two.
All right.
One, can I predict if somebody will have, can I predict if I or you or anybody will have Alzheimer? One question. Once I diagnose it, what kind of advice can I give? This is what you're asking, right?
I was for the first question before. If I can predict if somebody can have,
okay.
It's a pass, somebody can have this risk.
Okay. Okay. Let me sneeze for a second. We cannot really predict. However, there exist risk factors. Can you hear me?
Yes, I'm hearing you.
Let me put it to you like this. Can you predict if somebody will have a heart attack? And the answer is no, but we know risk factors for a heart attack. If you smoke, if you are overweight, if you don't exercise, if you have bad genetics, meaning your parents had heart attacks, if your cholesterol is high, if your hypertension is high, and on, you have a lot of risks to have a heart attack. So it doesn't mean that you'll have. Many people have all those risks and never have a heart attack. And other people don't have any risks and will have a heart attack. So we know risk factors for Alzheimer's disease, which make your chances of getting one much higher. But we cannot predict who will have it. Do you understand the difference?
Yes. That's perfect.
Okay, so the main risk factor is getting old.
Right.
Older
That's something
you,
I cannot do it.
so there are two risk factors which are not modifiable. One is getting old, second is genetics, meaning if you have in your family a first degree relative with Alzheimer, it is more likely, just risk, it is more likely that you'll get it, particularly if your relative, if your parent had it when he was relatively young, meaning 50, 60, 65, not 85.
But it's not hereditary. It's something that it's not. It hasn't been discovered, or for what we know, it's just 1% discovered that it's hereditary. No, there is the risk, but it's not something that you can rent.
There is no single gene. I mean, there are few rare diseases with single gene which causes it. Alzheimer is not the case. The risk for Alzheimer is polygenetics. So yes, you are right. It doesn't mean that if you had a relative with Alzheimer, you will get it. But your risk is slightly higher, slightly. So non-modifiable risks are genetics and age. There are a lot of modifiable risks. All the risks for cardiovascular disease are also risks for Alzheimer. So hypertension, having a sedentary life, being overweight, having diabetes, all the cardiovascular risks are also risks for Alzheimer's disease. In addition, being uneducated is a risk for Alzheimer's disease. Now, it is not the education itself that makes the risk, but the brain reserve that help you acquire the education. In other words, if you are born with a better brain that help you become a journalist, what are you, a journalist, right?
It's supposed.
You have a lower rate. It's not the education itself, but the brain that allowed you to acquire education means you come to the disease with a better brain reserve. So it's called education, but it's actually brain reserve. So to summarize, unmodifiable risk, genetics and age, modifiable risk, cardiovascular and education. Now, if you follow the literature, you'll find all the time, almost every day, people who have hearing problems, people who have cataracts but don't do surgery, and on and on and on. I can give you many examples which are also risk for Alzheimer's. However, it is possible that some of those risks are what is called in my business mediators, meaning people who are more educated are more likely to have cataract surgery. People who are more educated are more likely to have a hearing device. So I'm not sure is a fact itself or a third factor mediating it. Understand?
Yes. Tell me something, Professor. When you say educator, it means reading, it means practicing. Many people said that if you play, I don't know, video games, or if you play, or you stay all day in the TV or in the cell phone, uh, it will cause more mental diseases, or you will get more things like that, or that you have to be playing games like, I don't know, puzzles, or play uh, to prevent it. Does it help to do these mental exercises that every morning you start and do, I don't know, a mathematical problem, a big mathematical problem, so your mind will be working? It helps, or it doesn't help?
This is again what is called in my business reverse causality, meaning if you were born with a better brain, which allowed you, again, to become a journalist, sorry to pick up on you, it is more likely that when you are 75, you still read The Economist and the New York Times.
And Diario Judío. And read Diario Judío.
Of course. The point I'm trying to make, that's exactly what I'm trying to make. It is not what you do, but if you are one of those people who came with a better brain, with more reserve, not only you have a lower risk for Alzheimer, but it is more likely that at age 80, you still read like a maniac and on and on. It's not the reading itself when you're 80, but it is a brain that pushes you to read. You understand the difference?
Exactly. So it's good to do these exercises, like to do a physical exercise. It's good to do also some mental exercises, not just to be with that. Does it in these times and after the pandemic and after all these devices, like we were saying, cellulars, TV, more sedentary life, it has been a difference in what's happened with Alzheimer now, or it's the same that it was 10 years ago?
Realistic, I mean, people will tell you, my own experience, so and so. It's not true. You can speak on the phone as much as you want. You can watch TV. It doesn't make a difference. It's not good. It's not bad. Now, of course, again, it's very difficult when you do epidemiology to make mistakes. Give you an example. If somebody with Alzheimer's disease living with a husband or a wife, which is okay, but have not left home for a year, okay? Then you see them after a year, you say, look what COVID did to this person, he's much worse. But you don't know how much worse this, if you see this person every day or every week, you don't notice so clearly the deterioration. If you only see them once a year because of COVID, you are much more likely to see the deterioration. If you were sick with COVID, this is something else. But just being at home, no, doesn't make a big difference.
Tell me something. If there is not a cure, if there is not something I can do to change the probabilities of having or not having, do I have to be aware of Alzheimer? Or when I get in this situation, then I have to treat me and start worrying about that? Or do I have to worry about it and have something to do with that?
First of all, as I told you, you can change the probability. There are modifiable risk factors if you keep your blood pressure in check, and your cholesterol in check, and your diabetes in check, and you do a little bit of physical activity, and you see people, and you continue working, and on and on and on, you reduce your risk. Am I clear?
Yes.
So yes, there are things you can do. They are not specific to prevent it. They reduce risk.
And tell me something. When somebody gets Alzheimer, it's important to act at the beginning. It's important to just live with that. It changes the whole family. But does it have to do something like going to the Israeli Center of Alzheimer, or what to do when you say maybe he has Alzheimer?
To start with, there are coming, let me again take you to another area that is easier to understand. Is there a treatment for cancer today or not?
There are some treatments for some cancers.
Is the treatment for cancer today different from 50 years ago?
Yes, a little bit. There are some different options and probabilities.
But people still die from cancer, right?
Sure.
There's no cure for cancer.
There's not a cure, 100% cure for many of the cancers. No, for some.
Not even 80%. Not even 80%.
In the early situation, it will help you a lot of it.
Not even 80%, but there is medications, there are ways to reduce the mortality from cancer. So
Or
it
to
is the
live
same about,
different, or to live different.
first of all, there are few drugs, not very new. There are already on the market for 25 years, which slow by nature, the natural course of Alzheimer's disease is progressive deteriorating, meaning you get worse and worse and worse. It doesn't stop. There exist drugs which make this progression a little bit slower, okay? Also, nowadays, just very, very new, there are some antibodies which you inject, and they basically clean the bad proteins that accumulate in the brain, and earlier you get it, better it is. It doesn't cure the disease, but let me give you an example. I know it sounds silly, but give you an example. Somebody with Alzheimer's for 2 years, okay? He was diagnosed 2 years ago. By the end of the 2 years, if he has 3 grandchildren, he would remember only the name of one. If the same person gets medication from the beginning, after 2 years, he will remember the names of 2 grandchildren out of 3. So is it a big difference? Depends on how you look at life. But yes, there are, earlier you diagnose it and you treat it, slower the deterioration is.
Tell me something. When can you say somebody has Alzheimer, or when do you have to do something when you say, because you say, all right, he forgets the name of one of his grandchildren. That may be not about Alzheimer. It can be other ways, or he doesn't like that grandchild. That's another thing. But when you can say it's important to make a checkup to see that, because you cannot go to the doctor and say, check me everything in case I have this, and also Alzheimer. When it's important to say that person may be having Alzheimer, and we have to act now.
Okay. There is such a thing like people's memory and orientation and ability to learn new things decreases with age, okay?
But
this is life.
Normal.
You yourself were better, believe me, 25 years ago.
Yeah.
So there is such a thing like age-associated memory impairment. Then there is mild cognitive impairment, and then there is early Alzheimer's. When do you pass each threshold? This is something that I can tell from experience, from having seen thousands of people, I can say this person has passed the threshold of normal aging into Alzheimer, into dementia, okay? Now, there are a lot of tests you can do which will support my assessment when this person has passed the threshold from age-associated memory impairment into Alzheimer's. But they are only supportive. The main diagnosis is just talking to you. And again, it's a determination that comes with profession. Deborah, what I suggest that you send the gentleman my presentations, the ones that you have, because some of the answers to his questions are in the presentation.
I know, but I have most of them. That's why I'm asking this question. I read your
Good.
presentation.
I'm more than happy. I'm not
it.
going anywhere. I'm not going anywhere.
No, but it's good because somebody who wants to know about that, he can go to the presentation that you are invited for more response.
Yes, many people will be there you are going to be in Mexico. Tell me
you
something.
should encourage them. You should encourage them. Instead of me talking and talking, encourage them to ask questions. It's much more interesting to ask questions.
If I remember, I will do it.
Okay.
And another question. You asked me to ask questions, so I have questions.
Go ahead. I'm not going anywhere.
All right. Tell me what happens when it affects all the family. So when you detect that somebody forgets things, it's doing a little bit, like you said, not knowing where he is or something like that, what to do? What is the first steps somebody in the family has to do? I know, go and do the checkup and see if it has Alzheimer or not. That's the first thing. But what do we have to do, like a family,
Okay.
like a...
I'm going to tell you. Number one, make sure that the person doesn't find himself or herself in dangerous situation, meaning no driving. You'll feel humiliated, feels angry, no driving. Now, don't quote me for what I'm saying. Some people get very upset, say, no, I want to drive, I want to drive. And then I tell the family, make sure that the car brakes. Make sure that something breaks in the car and disappears.
I know, it's all right, yes.
Number two, so if you go to the sea, into the water, don't go alone into the water. If you take a trip into a new place, if you go to New York from Mexico City, don't let the person go alone. This is one thing. Second thing, the person will start asking the same question again and again and again. Do we have a doctor appointment? Yes, I told you already, tomorrow at 5. 5 minutes later, do we have a doctor appointment? I told you already, tomorrow at 5. So I explained the family, the person is not trying to upset you. Don't tell them you already asked this question. Just answer it again and again and again, because otherwise you'll get angry and the person will get humiliated. So there's no choice. Answer the question again and again. Another thing, very often, more or less 6 months away, 6 months to a year down the road after the diagnosis, the husband would tell his wife, you told me that you went to buy food at the supermarket. This is not true. You have a lover downstairs. You're going to your lover. Don't get upset. Try to say, no, I don't have a lover. I love you, whatever. But don't get upset. This is part of the sickness. Or a grandfather would tell his grandchildren, stop stealing my money. So again, don't get upset. This is a disease. The same way you don't get upset if somebody, I don't know, cannot hold his urine or his feces because he's sick. Don't get upset if the patient accuses you of having an affair, of stealing his money. This is part of the illness. Then I advise them to try to get organized at home, meaning make sure that they have a shower and that the person doesn't have to go into the bathroom, into the bath tube, because they will fall down. Take away all the carpets from the floor, because he will fall down. And if they fall down and they break a leg, it's very difficult to fix it, because they need physiotherapy and they cannot follow commands of physiotherapy. So make sure that the house is safe. Try to get help. You cannot manage somebody alone. Consider what is better for both of you, the patient and the healthy person, to stay home or to go to a nursing home. it is particularly a year and a half after diagnosis, there is absolutely no advantage. I mean, people would say, but at home, he knows his home, he gets individual care. This is true only partially. It's not really true. By a year and a half into the illness, he doesn't know that it's his home anymore, and individual care, it's not helpful anymore. I'll give you an example. Let's assume that a big, heavy husband gets Alzheimer's. Now, 2 years down the road, he has no control over feces and urine. So every morning, you have to wash him. Now, a wife alone cannot do it, or cannot do it well. Furthermore, the person many times will hit you if you try to take off his clothes, because in order to give him a shower, because he doesn't understand, well, what do you want? Why are you taking my clothes? So sometimes nursing home is better, sometimes it's not. I'm not saying that always, but it is definitely a legitimate consideration. Definitely, if at home, you should get help.
Tell me something. Do the person that suffers Alzheimer knows or is aware that it's suffering? Let me explain you. Maybe somebody tells you, you know, I'm forgetting many things now. Maybe I'm suffering Alzheimer. I don't remember what I ate yesterday. I don't remember it. Let's start. If you ask me what I did yesterday, I have to process my mind and start looking what I did, or look at my cell phone also. But many people
But eventually you'll figure out.
Yes. But many people say, maybe I'm suffering Alzheimer or that because I don't remember what I did yesterday. Do people know they are suffering Alzheimer?
Again, the fact that you don't remember exactly what you did yesterday doesn't mean anything. The fact that you meet somebody who you should know and you forgot his name doesn't mean anything. And on and on and on, okay?
Yes.
The fact that you have forgot to pay your bills doesn't mean anything.
If I forget my wife in the supermarket and don't come for her, it doesn't mean I have Alzheimer.
And by chance you find a new one.
That's because I have Alzheimer. I cannot say because it was Alzheimer, Ken.
You know what is a big advantage of having Alzheimer?
Yes.
You wake up in bed every morning with a new woman.
I prefer
Anyway.
it could be a 25 years younger woman, but it's okay.
Anyway, so at the very beginning, people realize, of course, but only at the very, very, very beginning. For most of the time, no. They live in their own world. And by the way, not all of them suffer. Actually, many of them are okay if they are taken care, meaning they are well fed and clean, and they don't have, you know what is pressure wounds? When people don't move enough, they have wounds in their back and in their ass. If they're, it happens very often to Alzheimer's patients. So if they are taken good care, they can have a reasonably good life.
All right. But in that cases, they are not suffering, they don't know. But when you speak with them, you have to wash, you have to dress to get, you have to take a bath and that. Can you tell them, when you are sick with cancer, they tell you have to go to chemio. All right, you decide I have to go to chemio. I'm aware I have to go to chemio. But I told you have to go and take these medicines or do that and do this. When you are with Alzheimer, they don't know.
They don't understand.
They don't understand.
No, not at all. Not at all. No.
And tell me.
This is why it's so difficult to care for them.
Yeah, that's what I was asking, because they don't realize it that way. All right.
No.
That's a good symptom. If somebody tells you, I'm having Alzheimer, I don't remember, all right, you are not having Alzheimer. All right. We already know. That's a good symptom. I can use it with somebody I know. So tell me something. So if there is no cure, there are some treatments and there are some things. What is the work of some place like the Israeli Alzheimer Center?
We do several things. We experiment what is the best kind of care, what kind of music is the best for them, how is the best way to wash them, what kind of dancing is best, what kind of story to tell them that they can understand, how to make their life, the quality of life better. This is one thing we do. Another thing we do drug trials, experiment with new drugs, which hopefully, like with cancer, will push it. Like if we can get a drug that makes Alzheimer appear in average, I'm talking now average, okay? The average of appearance of Alzheimer's disease is around 77, 78. Again, average.
But it's a very high average.
Average. There are a lot of people who are 50 who get Alzheimer's. I'm talking average. If we can put the average fully by a year, I mean, instead of the average being, let's say, 78, it's 79 now, okay? Most people die by age 81, 82, 83.
220, please.
So, so anything that we can push the onset, even by a year or by 2 years, makes a huge difference in terms of epidemiology. So another thing that we do, we experiment with different drugs, trying to push the onset of the disease later.
Right. Tell me something. You are coming to Mexico. We talk that you are going to have here a presentation that you would like people to ask questions about it, not to do a presentation, to ask questions. Why are you coming to Mexico? What can you tell us? If there are some, who can be there? Why they have to be hearing an Alzheimer? If I don't suffer from somebody, I don't know somebody who is going to have it. Why do I have to hear a presentation about Alzheimer?
I don't know. Ask Dora. Why people? I don't know why people do anything. Why people come to listen to a presentation on history, a presentation on whatever. By the way, I'm a psychiatrist by training. If people want to talk about schizophrenia, about depression, about anorexia, about autism, anything that has to do with psychiatry, I can talk to them about any other subject in psychiatry.
I think they have to be there because like we did today, there are many questions, there are many myths, there are many things that people should know just to determine if you can have it, what happened, what will happen, and to be prepared because like other diseases, let's say cancer, talking about, you are in a treatment, you have to do some changes in your life because you have to take the person to treatment and everything. But with Alzheimer, the whole life changes because you have to change everything to take care of this person. It's not just a medicine or that. So you have to be prepared.
Also one thing to keep in mind, like with every disease which doesn't have an absolute cure, there are a lot of scams around Alzheimer, injecting cells into your brain, oxygen pressure, and on and on and on and on, which are all a scam. You know what is a scam?
Sure. We call it also magical medicine or magical products.
Yeah. But people
take this and you will be cured about in a month. You will be cured.
But people believe in it.
People have to have hope, but it's very bad to have to believe.
If you have a charismatic doctor, they can sell you anything.
Yes. You know we have a media We have also from Diario Judío, we have a media that it's called medical notes. Because when somebody detects that somebody else is sick, everybody has a solution. It's incredible. If you tell somebody, I have I don't know, chicken pox. Somebody will tell you, for chicken pox, you have to eat this. Where did you read it? In internet that you say they are fake, they are good. So we try to do it in this page to bring back down all these scams, all this magical medicine, and give some real solution. It doesn't mean real solution. It has to be medicine also only.
By the way, in many diseases, which are on, off, meaning they're self-limiting diseases, you do this magic and you get better.
Yes.
Because it's a self-limiting disease. And you turn around and say, look, I was right. If you eat whatever, look, I got better.
Yes. The best one is when you are sick of the stomach illness, drink a that drink a Coke and you will get it.
And you get better. Yes. And you get better.
Yes, it has to be. Right. That's why. So one of the important things with Alzheimer is to bring down all these myths. And that's important for people to come and say, all right, here, be prepared. Because it's something when it hits you hard.
This is why I said I prefer to have questions so I can address those issues. I can explain why it is not true. I can explain why not. It's not just because I'm saying so. I can explain why not.
All right, that's important. Not just to say no, to know why not. That's very important because many people stay with that's the correct. Somebody in the family, a cousin from a cousin from a cousin from a cousin.
I know exactly what you mean.
Professor, something else you would like us to know about Alzheimer now? Something that we forget, not because we have Alzheimer, because we are journalists and we forget many things. Something else you think it's important to people to know about Alzheimer?
Well, if they are interested, what is on the horizons in terms of treatment, I could talk a little bit about it because there are billions of dollars being invested by the big pharma and by governments trying to find a solution. And there are a lot of things in the horizon. What will pin out to work or not, I don't know. But there are many things that I can talk about what is in the horizon.
Just to put it clear for some people, there is how many people suffer in a percentage, how many people can suffer or be in the risk of Alzheimer, and there is any prediction or anything for Jewish people, not being racist, because there are some illness that curiously attack some kind of Jews, especially Ashkenazi, for example.
In general, it is almost 1% of the general population. So if Mexico has, what's the population of Mexico?
130 million.
So you should probably, more or less, you have 750,000 of demented people. Not just Alzheimer, dementia, all the types of dementia. So about 750,000, maybe a little bit more, okay? No, there is nothing about being Jewish that increases or decreases the risk. Neither way.
And the last question. When you study Alzheimer, it is related with other mental illness that you can be, and that's more important for people to be. You talk about dementia, but there is some kind of
people who throughout their life have severe mental illness, but severe, like major depression or schizophrenia, are more at risk of having Alzheimer's, yes, but only major diseases.
But when you study and you know about Alzheimer, you can know also a little bit about the other mental illness. So it's important for that to be aware of all these kind of things.
And if they want to ask questions about other mental diseases, no problem.
Right. Yeah. My wife wants to know why I do many things, but that's, she said it because it's a mental illness of mine, but that's different. Yeah. She will ask you about that. All right. Deborah,
Okay, I will answer her. I will answer her.
all right, I will take her. Maybe you can cure her. I know, you cure me. Sorry.
Okay, no problem.
Deborah, ¿algo más que te gustaría tú aclarar, decirnos, invitar a la
No,
gente?
creo que... bueno, sí, yo no suponía que no iba a hablar, pero bueno, lo que habías preguntado era por qué la gente dice que... Bye. Don't leave. Aל תלך, אני אקצרה.
Okay, no problem.
Nosotros creemos que cuanto más gente tenga conciencia de lo que es la enfermedad y antes pueda darse cuenta y poder consultar, estamos siempre dando un paso antes de que la enfermedad nos agarre por sorpresa. El profesor es una persona que tiene un amplio background profesional, está asociado a un montón de universidades importantes y él forma parte de un montón de investigaciones, y es una persona que de verdad puede, en vez de darnos todas las fake news acerca del Alzheimer, puede contestar a todas las preguntas que todos nos hacemos con respecto a la enfermedad, cómo tratarla, qué conviene, si la comida solo es importante, si el deporte solo es importante, y todas las cosas que ya hablaron. De todo esto, el doctor va a hablar cuando esté en la conferencia, el 1 de noviembre, a las 7 de la tarde, en el Monte Sinai.
Durante las jornadas médicas.
Durante las jornadas médicas, exactamente.
Pues, muchísimas gracias, Deborah. Muchísimas gracias, professor. You have like 3 weeks to learn Spanish, to give your conference in Spanish. I know you can do it. We hope you can do it. We will be there to help you with that and to make many questions.
Okay.
Bye.
Bye. Thank
Gracias
you.
por todo. Adiós. Bueno.
The recording has stopped.
¿Cómo lo viste, Deborah?
Bien, yo no quería salir en la pantalla, pero no sé por qué mi control no me dejaba salirme de la pantalla.
No te veías, por lo menos de lo que yo tenía, yo lo tenía abierto a solo el speaker.
Perfecto. No, él es de verdad.